So, optimal health and well-being as a resource. So, we can view optimal health, which is being sort of at our best health that we can be, as a resource, having benefits to many people, and also we can look at it on a national level and a global level. So, optimal health and well-being is a resource that can be attained and it can also be lost. So, the World Health Organization declares that health is seen as a resource for everyday life, not the objective of living. So, this is another good quote to sort of be familiar with. So it's a resource that helps us to live, but it shouldn't be the reason we're living. So we shouldn't be trying to obtain health as like our life goal, but it's a resource for helping us to live and achieve our health, like our life goals. There's good examples in the HHD course notes for 8 Notes Plus that illustrate this concept if you want to have a look at them. So here's a table that I think really sums up the benefits of optimal health and well-being, this sort of concept all in one. So we're looking at it on an individual level, national and global. So we need to know examples for all three. And questions will tie this concept in with other concepts, as well as asking you to list like an individual benefit, a national benefit, and global. So you want to be pretty familiar with a few of these examples and have a good understanding so you can kind of expand on them. So, by being at our optimal health and super healthy, this is a resource individually as it helps us to become employed, to obtain education. Whereas if we were really sick, we wouldn't really be able to go to school or go to university if we were in and out of hospital or suffering from a really bad condition or disease. It helps us to increase our income because we're able to work and get paid. It helps us to access necessities, so we'll be able to go to the grocery store and buy what we need. We have access to water, we have a house, we have a roof over our head, we have access to healthcare, we can afford treatment, that kind of thing. Recreational activities, so we can participate in other activities in our life. We're not sick and injured and unable to participate in other activities. We can live more independently. So if we were really sick, we might need a carer or a family member to look after us to make sure that we are okay. Whereas if we're healthy and at optimal health, then we can live independently on our own. We've got lower healthcare costs as we're not always going to the hospital. If you're at optimal health, you're not paying for as much like treatment and medication, surgeries, anything like that. So you've got less healthcare costs, which is always great. And increased enjoyment of life as you're not suffering that illness that goes with disease. If you're at optimal health, you've got sort of a better view of your life as you can enjoy it. You don't have to worry about sickness and your disease and managing it. So they're the benefits to an individual. That if we look at the nation, so if all the individuals within a nation were at optimal health, it would contribute to the economy. So everyone's sort of working more because they're healthy and they can work, which makes all the average, like the productivity at work higher so that we can make more money and that money can go back into our economy to use for other things. We've got higher taxation revenue, which sort of goes hand in hand with more people going to work, being more productive. We're making more money as a country. The government can improve infrastructure because we have that extra money that we can use on things that we need. We can create emphasis on health promotion, so focus even more strongly on preventing diseases and things that can be prevented, such as like lifestyle diseases such as heart disease, cardiovascular disease, chronic obstructive pulmonary disease, lots of those things. We've got less burden on the public health system as well because less people are sick, less people are in the hospitals all the time, so we can sort of keep the strain off the hospitals and the public health system so that everyone can access it a bit better if like Australia was more at optimal health. Then globally, we look at the benefits of optimal health and well-being as a whole globe. So if everyone over the globe had more optimal health and well-being, I mean, it's a pretty unrealistic goal to think that everyone globally would be at optimal health and well-being, but in an ideal situation. This would enable universal access to healthcare, so everyone across the world could access healthcare, Whereas in Australia, we're pretty lucky. Most of us have universal access to healthcare. We can get it whenever we need, but globally is a different story. So we could improve everyone's access to healthcare. We'd reduce rates of communicable and non-communicable disease. So if you haven't heard these terms before, communicable means an infectious disease, one that spreads from one person to another. And non-communicable disease is one that can't be, like, it's not contagious, it can't be spread. So it's like something like cardiovascular disease. It's sort of caused by the person's own actions. Not always, but it can be. And it's not like infectious, it's not contagious and spread to another person. So reducing rates of both types of diseases, increasing emphasis on other transnational issues. So because everyone's sort of a bit more healthy, they'll have better functioning immune systems and less likely to contract these infectious diseases. And if we're looking after ourselves, our optimal health and well-being, they're less likely to develop lifestyle diseases like cancer, cardiovascular disease, type 2 diabetes, and asthma from smoking, things like that. Sort of making the whole nation a lot healthier. Increased levels of peace and security. So if we're, as a globe, at more of an optimal health and well-being, it increases the levels of peace and security as we're, sort of trading more with other countries, increasing our relationships with other countries as we have the money to spend and form those relationships between other countries, which keeps the peace. We can have more secure systems in place, that kind of thing. So if you have any questions about any of these points, please put them in the chat and I'll get back to you as soon as I can. So using health as a resource, if we bring it all together, we can see sort of how they impact each other. So if we have optimal health and well-being, this could be associated with being free of disease and injury or any negative aspect of any dimension of health and well-being. So for example, being free of disease and injury, that would be a physical health and well-being aspect. So as an individual, this is a resource as adults can feel well to go to work and earn a stable income. Then in a national point of view, we've got more people contributing to the economy. Governments can use the increased tax revenue that they're earning to develop a healthcare system for all citizens. And then if we look on a global scale, coming closer to achieving universal health coverage, morbidity and mortality reduces, allowing countries to work together to combat broader issues like climate change. So you can see how it sort of has that cause and effect. If we have optimal health and well-being, it's a benefit for the individual, for the country, and globally. So Australia uses information and statistics like Australia's health to shape and improve the health of all Australians. It's widely recognised that optimal health and well-being is a resource. Describe 2 benefits of the importance of optimal health and well-being for Australia. So for this question, because we're referring to Australia, hopefully you know that that would mean we're looking at health and well-being as a resource nationally. So that middle column that we just looked at. So we want 2 benefits and we want to link it to Australia's health and the information provided. So always feel free to go back to these slides. You can download them later and have a go at answering these questions yourself. But we're going to take a look at the answer here. So optimal health and well-being is associated with being free of disease. So that's optimal health and well-being. As a result, more individuals are likely to work productively, leading to higher average incomes. So that is a benefit of health and well-being as a resource sort of individually, but we're about to tie it into as a nation, so just bear with us. Higher average income leads to greater taxation revenue for the government, providing the government with a greater opportunity to build more infrastructure. For example, more hospitals, a national benefit of pursuing optimal health and well-being. So there we go. We've linked it to the nation, we've linked it to the government and how it helps Australia as a whole. Furthermore, so another really great word to use when you're sort of describing your answers in health and human, optimal health and well-being is associated with lower levels of stress, so optimal mental health and well-being, which can lead to the public health system savings, as the Australian population would be experiencing lower rates of mental health conditions, example, depression. Therefore, they're less likely to visit medical professionals for checkups. So there we've got another link. We're referring to the population, not just individuals here. So as a result, resources in the public healthcare system can be saved for those who need it most, such as older people, another national benefit of optimal health and wellbeing. So this is a really good sort of practice question example of a really good response to the question that we just looked at. So we've got links to Australia as a whole, and we're talking about national benefits. See, this one at the start, we're talking about working productively as an individual, but we link it to higher average income. So we're talking about the nation as a whole. So make sure that you're not sort of listing individual benefits, you're talking about the national benefits if that is what the question is asking. And we've provided a bunch of examples, which helps to sort of show that we know what we're talking about and give a clear response.